with their clients.
When Lizzie DeTore starts college in January, she'll be a long way from home.
Where are you going?
Hawaii Pacific University.
The aspiring marine biologist from Niantic is headed to college out of state. Dealing with PTSD and depression, Lizzie is one of thousands of teens who attends therapy.
I trust that person. I feel like I can talk to them.
But when she heads to Hawaii, those sessions will end.
It's going to be a big change, especially not having the support of the people I know too, since I'm so far away.
Due to licensing laws, students going to school out of state can't regularly see therapists licensed in Connecticut. The same goes for students who connect with therapists at school and then travel back to Connecticut for summers. During the pandemic, those licensing restrictions were loosened to allow therapists to practice over state lines using telemedicine. But those restrictions went back on the books in April, and Lizzie will have to find someone new in Hawaii if she wants to continue therapy.
It's hard opening up to someone you don't feel comfortable with.
They have enough of a transition already.
Alyssa Colasar owns the practice where Lizzie's therapist works. She fears too many out-of-state students will face mental health struggles without the same options they had since the start of COVID-19.
There isn't accessibility anymore. So whereas people were able to find therapists maybe in other states when they did move or when they did go to college, the problem is there aren't therapists to be had.
Now, there is a way for some providers to offer teletherapy across state lines. SciPact is an agreement between the states in dark blue you see on this map.
It's basically saying all the states agree that if you have this license, that you are able to practice in that state.
Connecticut is poised to join the SciPact agreement on October 1st, but it only applies to psychologists, not to the many licensed clinical social workers or marital and family therapists like Lizzie's.
And ultimately, the goal would be able to have something for therapists to be able to practice across state lines.
Unlike Colasar, Dr. Ralph Dodd is wary of how quickly license restrictions were loosened during COVID-19. He's the Regional Director of Collegiate Counseling for Hartford Healthcare.
Part of the reverting back to the old rules or the way things used to be is to try to have a good understanding and making sure that everyone who's practicing is doing it the right way.
Dr. Dodd recommends setting up a three-way call between an old provider and a new therapist to share information. But even he acknowledges it's not always easy to make the switch.
I actually had a case the other day where a student is trying to keep their therapist, and they're actually planning to drive back and forth about 2.5 hours.
I don't know if it's worth it to keep trying when I already have somebody I can talk to.
We're not supposed to abandon our clients. Cutting them off in that way or asking them to drive, 2 hours away to go see their therapist, it's just not helpful.
In Rocky Hill, Audrey Russo, Channel 3 Eyewitness.